suicidal subject. Should be nobody else in the house.
It was a police radio call that happens routinely across the state of Colorado.
Suicidal subject. Wife was advised to leave the home.
The wife of 40-year-old Randall Roddick called the Douglas County Sheriff, reporting that her husband was loading his guns and talking about dying.
Male has a loaded 9mm with him. He will kill whoever tries to stop him.
Both his wife and relatives said Roddick had been depressed for years. He was an alcoholic and addicted to opioids and talked often about suicide.
He has a gun room in the basement, multiple caliber guns.
There had been previous police calls to his home, and before the shooting, his wife said he was going crazy.
The RP is reporting he is willing and ready to have a shootout with us.
We kind of assumed that if he was going to commit suicide, why would he be loading up all these guns and ammo? This could be a suicide by cop.
One of the officers responding was Detective Dan Bright.
As soon as I got into position, he started firing AK-47 directly towards me.
Shots fired! Shots fired!
Because of the way the vehicles were positioned, I was the only officer that he could see.
Shots fired! Man down! Man down! One of ours!
So I knew a law enforcement officer had been shot and was down.
Officer Ronnie Durrell from the Parker Police Department had heard the gunshots and the radio traffic.
I was probably about maybe a little under a half mile away.
Roger Adam, he's on the road, he's on Dixon.
And we got information that the suspect was mobile.
Still in his RV, headed through the field if someone could try to contain him.
When the suspect went mobile, I said, hey, we're gonna go.
I'm taking your car!
Durrell and another officer immediately ran for a nearby police car to respond to the RV on the run.
My whole thought process when I was going was, we need to stop him and we cannot let him get to Parker Road. At that day and time, very, very populated, a lot of innocent lives are nearby.
Roddick continued to fire as he drove the RV through a field toward a middle school, shooting at a local hospital before crashing his vehicle.
What kind of car is it?
It's an RV, big white RV.
As I was responding, I knew what this individual had just done. I was trying to prevent him from getting access to the public.
Shots fired! Shots fired!
There it is, bro.
Shots fired.
There's a pickup truck and like a smaller SUV pulled over on the side of the road. And I immediately knew that was my cover.
Where's he at? Where's he at? Move! Move! Front seat, front seat.
I took a position, I raised my rifle, and I knew I had to stop the threat.
I got him! He's down! He's down!
232, suspect's down, gunshot wound to the head.
While the threat was over, the radio was crackling with the news no one wanted to hear.
Who got hit? Is he all right? No.
Dan Bright was shot.
It's just a really weird feeling, just knowing that this was the last place where I was healthy and I was able to walk and I was able to carry on my life. Man, that kind of puts the focus on what has been lost.
It was a poignant moment when he returned for the first time to the place where he was shot.
I think there could have been more provided to him to become healthy.
Remarkably, Dan Bright does not blame the man who shot him.
More resources, more education on his part and on his family's part.
This view comes from his perspective as a detective who has dealt with countless calls involving the mentally ill and people in crisis.
We are often the last line of defense in trying to get them the help they need. I don't think they should have to interact with law enforcement in order to get that kind of health care.
And that's what's happening every day?
Right, right.
How many times are you dealing with mentally ill people or suicidal parties just in your daily routine?
Every day, multiple times a day.
Is there a toll on you as an individual for having to do this?
Yeah, absolutely. I've been told I'm not the same person that I was 3 years ago. It changes you. I've dealt with my own mental health as a result of the situations that I've been in.
And 15 months later, it happened again. Ronnie Durrell was called as part of a SWAT team to a Highlands Ranch apartment complex where a mentally ill man, Matthew Reel, was holed up in his bedroom with high-powered weapons and ammunition.
Who is there at the door? Identify yourself now.
Reel had been raging for hours, live streaming parts of his rant.
Did you not get that message?
And when other deputies tried taking Reel in on a mental health hold,
Sheriff's office!
he fired on them, wounding 4 officers and killing Douglas County Deputy Zach Parrish.
I could tell you how many rounds he fired, but it was in the hundreds.
Now, Durrell and his team were sent in to try to end the threat.
They're going!
I was the first one that went into that apartment with my team, and we were immediately met with gunfire from Matthew Reel.
It was an all-out firefight.
I could feel bullets passing my face. I could taste the drywall that was in the air from all the rounds that were being shot.
For the second time in his career, Ronnie Durrell fired his weapon in the line of duty. And for the second time, he killed a mentally ill man. In both the Roddick and Reel cases, the local district attorney ruled Durrell had no choice but to act.
We have responded so many times to suicidal parties and people with mental health disorders that law enforcement is synonymous with mental health now. I wish there were better avenues for people that are dealing with mental health issues, because I don't want what happened to Zach to happen to anybody else. I don't want people to have to lose their lives because their mental health disorder overtook them.
Our independent analysis of police shootings in Colorado found at least 33 people shot by police since 2016 had a history of mental illness, were suicidal, or seemed to be in a mental health crisis at the time of the incident, according to investigation reports. That's at least 17% of 185 incidents.